Hey guys, how you doing? Just having a little bit of coffee here, and I thought that I would share some information with you guys. I wanted to ask you a question because this is something that I think a lot of people don't realize. But do you know how hypothyroidism is diagnosed? I'm trying not to be too loud. Do you know how hypothyroidism is diagnosed medically? You might think that it's through the measurement of your thyroid hormones, but it's actually not. It's actually diagnosed through the measurement of your TSH, your thyroid stimulating hormone. And if you recall, TSH is not your thyroid hormone. It's actually a hormone created by your pituitary gland in the brain. And so your doctors, if the TSH is high, then they reason that your thyroid hormone must be low because your brain makes more TSH in an attempt to stimulate the thyroid. So they think if TSH is high, the brain wants the thyroid to make more hormone. So TSH is high. Usually if it's over like the lab range in my area, and it varies. Lab ranges vary from lab to lab. Believe it or not, it's one of the reasons that in practice I'll use functional ranges or ideal ranges in combination with the lab range because they're different all over the place, and there's no standard for most labs. So TSH in my area is considered lab high at 4.5. Okay, so if you're over 4.5, you're diagnosed as hypothyroid, and that's how you get diagnosed as hypothyroid. It's through the TSH. It's not actually through the T4 and the T3. Now, if you have T4 and T3, then it does make a difference in the doctor's diagnosis. But TSH is used to titrate thyroid hormone replacement therapy. So it's interesting. I think in practice, it's not an adequate way, especially with the population of people that I work with, to really evaluate thyroid function. You've got to look at total T4 and total T3, and I look at free T3 and free T4. We get T3 uptake, reverse T3. We get a lot of other markers. I always get the thyroid antibodies on every patient and every distance consulting client, because if you don't have that, it's hard to know if the person has, if they have Hashimoto's, which is really, really critical. It changes the way that you address and you work with a lot of people that have thyroid related symptoms. If they're autoimmune, then the autoimmunity has to be addressed number one. I mean, you have to address the autoimmunity and try to dampen the autoimmune process if you really want to help the person. But anyway, thought I'd share that with you guys, and just try to give you some tips as frequently as I can. Keep educating you, keep empowering you, so that you can take your health back. So I hope this helps you out, and if you have any questions or you need anything, just let us know. Thanks.